All right. So the question is, my mom started to show dementia symptoms after my dad, her husband, died. Can depression cause dementia? Yes, it can. Yes, it can. Thank you for asking your question. So I'll tell you this. Depression looks just like dementia on someone over the age of 65. So I don't know if you all were ever told this, but I know growing up, I was taught that as you get older, you're going to get a little bit of dementia. Well, you can't get a little bit of dementia because you can't be a little bit pregnant, can you? Okay. You can't have a little bit of dementia. What they're saying is you may have mild cognitive impairment or you may be experiencing early stages of dementia, but that's not the case. Simply because although age is the number one risk factor, simply because you're getting older does not mean that you're going to get it. There are more people over the age of 65 who don't have dementia than who do. So yes, depression looks just like dementia. What the doctor can do is a depression scale and a depression assessment. You would think that the doctor would do that automatically. They don't. But if you ask for it, they will. Doc, can you do a depression assessment to determine if my mom is dealing with depression more so than dementia? Because depression can be treated. A progressive type of dementia cannot. You can treat the symptoms for a certain period of time, but eventually those medications are not going to be effective. So depression, if not treated, does increase one's risk of developing dementia. So by you telling me that you started seeing these symptoms after your dad passed away tells me that was a trigger. That was a trigger. So what happened before you started seeing these symptoms? Dad died, right? So that's something that you want to talk to the doctor about. Again, depression can be treated. It can be treated with lifestyle changes. So it may be that, I don't know if she lives alone or not. It may be that you guys come over more often, take her out more often, send her letters, get her on Facebook. And so you may try to use technology to keep them engaged. You may even try a low dose of an anti-depression medication, but you want to get that from the doctor. You don't want to get any medication over the counter. I know that there are a lot of natural products out there and medications. I can't say yes or no because number one, I'm not a medical doctor, so I'm not going to provide any medical advice. But what I will say is you don't want to put anything in your body without the primary care doctor knowing about it, because it could interfere with other medications you're taking. It could interfere with other conditions you have. And, it's a lot of stuff online, on TikTok shop, on Facebook, that says heal this, treat this, heal that. But when you get the package, it say call your doctor. That's what you need to do. Call your doctor before you put anything in your mouth or on your skin. Salves are the same thing. Those ointments, that's medication. Sometimes people may take